BPH means benign prostatic hyperplasia. So it's an enlargement of prostate. First of all, we have to know what is prostate. Prostate is a gland which is located just beneath the bladder. It is around the size of a walnut. Our urinary tube, that is urethra, traverses the prostate, and ultimately the bladder contracts and the urine is expelled through the urethra. So, as we age, around the age of 60, around 50% of the men will have some forms of benign prostatic hyperplasia. And in 50% of those patients, the symptoms will be more severe that needs attention.
What are the common signs and symptoms?
So common signs and symptoms are the patient usually complains of weak flow of urine or hesitancy in urine, that is a problem in initiating the urine, or a intermittent flow, that is the start and stoppage of urine, or dribbling of urine post maturation. So these are initial symptoms. When the patient comes to us, we grade their symptoms according to AUA score, that is also known as IPSS score, to know how much severe the symptoms are, whether it is mild, moderate, or severe. Patient with mild symptom does not need any form of medical treatment or surgical treatment, but patients with moderate to severe symptoms need some sort of treatment.
Okay. How is BPH diagnosed and what are the available treatment options?
So BPH, diagnosis of BPH is usually by clinical examination and by ultrasound. So in clinical examination, we evaluate the external genitalia of the patient and do a digital rectal examination. So that examination usually the urologist conducts the examination and palpates the posterior surface of your prostate. And the ultrasound basically evaluates the patient's kidneys, ureter, the condition of the bladder, and the size of the prostate and its echo texture. The flow is evaluated by a test called uroflowmetry. In uroflowmetry, the graph is elucidated and we can ascertain whether the flow is at par with normal males or the flow is obstructed. And the basic test is urine routine and microscopy and urine culture if the patient is having severe symptoms.
Can BPH also lead to more serious health issues?
So if the BPH is untreated, left untreated, it can land up the patient in chronic kidney disease. That is, the kidneys are decompensated. It cannot filter out the blood. And the second complication which occurs is usually a bladder stone. So when there is a large residual of urine, the crystals get precipitated in the urinary bladder and that leads in formation of urinary stones. The third complication that can happen is a gross or microscopic hematuria, that is passage of blood in the urine.
What is the most effective treatment for an enlarged prostate?
So first of all, we have to evaluate the how severe the symptoms are, whether the patient has developed any sort of complications or not, severity of symptoms, and the condition of the kidneys and the bladder, and the PSA. PSA is secreted by the prostate gland exclusively only. So we have, before initiating any treatment, we have to be make sure that there is no foci of prostate cancer in the patient, because prostate cancer also leads to this sort of symptoms. They don't have any exclusive symptoms. So before initiating any treatment, prostate cancer has to be ruled out, and that is done by a simple PSA test. The normal serum PSA ranges from 0 to 3, 3.5, but if your PSA is elevated, we need to work on that. So if the patient have severe symptoms, the first of all medical therapy is alpha blockers. Alpha blockers give response to the patient within 3 to 5 days. The second modality of treatment is 5-alpha reductase inhibitors. So these molecule usually what they do, they shrink the size of the prostate and the effects come over a long period of time, that is 3 to 6 months. So in those subset of patients where medical therapy is not suitable or the patient does not respond on medical therapy, surgical treatment is usually advised in the form of a laser surgery, that is HOLEP, or a bipolar TURP, that is resection of the prostate gland. So there are a few absolute indications of surgery like recurrent UTI. If the patient is having frequent episodes of UTI within a span of 3 to 4 months, or he has developed a complication like CKD, that is chronic kidney disease, or the patient has developed grass or refractory hematuria that is not responding to any treatment, or the patient has developed bladder stones. So these are absolute indication, but there are some relative indications also where the patient does not want to take a daily dose of medicine. He can always walk into the OPD and tell doc, I need to undergo surgery and please remove my prostate.